Access to Democracy is made possible by donations from the following organizations. Thomson Reuters, a global company with expertise and insight to unravel complex situations in the areas of law, tax, compliance, government, and media. Their worldwide network of journalists and editors keep customers up to speed on relevant global events. Crutchfield Dermatology, a full-service treatment center and Medi-Spa in Eagan. Their goal is to help you look good and feel great with beautiful skin. With service built around courtesy, dignity, and respect, Mayo-trained Dr. Charles Crutchfield personally treats each patient and is acknowledged as one of the nation's best physicians. Truestone Financial, with locations in Minnesota and Wisconsin, has proudly served its members since 1939. Truestone engages, educates, and supports its members to ensure they have the tools to empower their financial well-being. Truestone Financial, your neighborhood credit union. Learn more at truestone.org. Edina Eye Physicians and Surgeons, a division of Twin Cities Eye Consultants, has proudly served the Twin Cities for more than 55 years now in 7 convenient locations. Using the most advanced technology combined with human touch, Edina Eye offers comprehensive services and dedicated specialists committed to excellence with innovative procedures and expertise for the most advanced eye care.
Welcome to another episode of Access to Democracy. I'm Steve Francisco with you today on this beautiful, hot, midsummer day in Minnesota. It's my pleasure to welcome an old friend of mine and a very interesting young man, Hunter Cantrell. Welcome to your first appearance on Access to Democracy.
Well, thank you, Steve. It's a pleasure to join you today.
So, because you are a first-time visitor to our show, tell us a little bit about yourself, like where you grew up, where you went to school.
Yeah. So I grew up in Savage, Minnesota. And it's still where I live today. It's my home. And I love Savage, and I also consider myself also partially a resident of Burnsville, just because I did graduate from Burnsville High School, and I'm still very connected to all of my friends and neighbors who live in the Burnsville community as well. I attended Inver Hills Community College for a couple of years, and then also attended the University of Minnesota, taking a leave of absence for a reason that we'll talk about soon here. But eventually, finally getting my degree after several years I got a Bachelor's of Science in Law, Health, and Life Science there.
So you're holding something back from me right now, Hunter. That is, you actually have some family roots next door in Wisconsin, don't you?
Oh, Steve,
you want to tell us about that?
Yes. So
you have to own up to that.
You're absolutely right, Steve. So no, I love my family, my neighbors to the east of us. So I am originally from Wisconsin. I'm originally from the Oshkosh-Neenah area. My family had been from the area for generations until we moved to Minnesota and Savage, where we currently live, in the early 2000s. It was 2002, 2003 when we moved to the Burnsville, Savage area.
When you saw the light and your family came to the good life.
Yeah, there you go.
Across
there you
the
go.
sink,
And
right.
we do have a good life here. We love it.
Yes, we do. Hunter, I want to ask you about something serious because I think it gives our viewers an insight into who you are and what you went on to do. You've had, for being such a young guy, how old are you again?
I just turned 27.
Just 27 years old. You've had a remarkable experience in life for someone so young. Tell us about a few years back when you went through cancer.
Yeah. So I know that that you and I have shared this journey together, and you and your wife were a huge support to me through that time. So I want to thank you for that, of course. But yeah, when I was 21 years old, I had taken a 6-month leave of absence from the University of Minnesota after the fall semester of 2016 because I had started to really feel kind of not just burnt out, but really a sincere lack of energy to the point where I fell asleep during a physics lecture once. And now, to some people, that might not be remarkable, but I woke up halfway through the next lecture. A whole different class of people had come in. So that's when I knew
something was wrong.
Something was wrong.
Yeah.
And so I took a little bit of time, and I ultimately decided to take the spring semester off of 17 to figure out, if I was just burnt out or if I just needed some time away to, figure things out. And that's the start of that. In January, I found a swollen lymph node above my clavicle that would go on to grow to about the size of a golf ball over the next several months, culminating in my diagnosis with stage 2 Hodgkin's lymphoma in May of 2017. And that's when they also found a fist-sized tumor in my chest wall. So that was ultimately what led to my absence from the U of M. And then I went through that experience.
But and we should say too, you had insurance, right? So you were able to get good health care. You were able to get good doctors who took care of you and actually brought you back to health. You beat cancer.
Right, I did.
But your experience with cancer did something else to you, didn't it? It transformed you from really a healthcare consumer in the sense that you had to use medical services to help you recover. But it pointed your whole life in a different direction too, didn't it? Tell us about that and what you went on to do.
Yeah, it really did. And I was very fortunate because of the Affordable Care Act that I was able to still be on my mom's health insurance at the time. She worked as a nurse, continues to work as a nurse.
In Shakopee, right?
Yeah, at St. Francis. Yep. And we love the nurses at St. Francis and everywhere. And it was because of the provision in the Affordable Care Act that you can stay on your parents' health insurance until 26 that I'm alive today. And the ACA has its issues, of course, but I was in the middle of receiving chemotherapy, in the middle of my 6-month stint of getting chemo. When I was watching live how the U.S. Congress was trying to vote to repeal the ACA without a replacement, which would have put myself and millions of other Americans with all degrees of pre-existing conditions at risk. It would have endangered our lives. And so that's when I really started thinking about how I could use the privilege that I had to be able to afford a very costly course of treatment and parlay that into helping others afford the same.
We should note too at this point that the ACA helped bring 32 million Americans who had no health care insurance at all, got them health care.
Right.
Health care insurance. And fortunately, there were some legal challenges, as we both know, challenges in the U.S. Supreme Court about the constitutionality of the ACA Act. Luckily, those were knocked down. That was before we had the radical Supreme Court that we have now with a political agenda, it seems.
Exactly.
But that was a different time. So tell us, you ended up running for the Minnesota House from your home area, and you won in a predominantly Republican district. You won as a Democrat Farmer Labor Party member. Tell us how that happened.
Yeah, honestly, I love everyone in my community, and it was really invigorating to me to go to the door, not as a Democrat, but go to the doors as just somebody who cares about people's quality of life and improving, the day-to-day circumstances that people face, whether it's, making sure that their kids in their local schools have all the resources they need to thrive, to having good paying jobs, stable shelter, and of course, access to affordable health care. And so ultimately, I'm very grateful that my community entrusted me and put their faith in me to represent them in the state house. And it was a tremendous honor, and we got there because we really just had conversations rooted in our shared humanity and our shared values that weren't based in partisanship, but were based in our mutual desire to make sure that we had a community and state where everyone could thrive.
There's something to be said for a brand of politics that a lot of us have been used to throughout our lives in Minnesota, this business of door knocking, actually having that face-to-face interaction. And heaven knows I've knocked on thousands of doors during my lifetime here in Minnesota. That's how we met. That's actually right.
Yes.
You came to my house door knocking, and it was the beginning of a great friendship when we struck up a common interest in politics and public policy and things that continues to this day.
Yeah.
Very fortuitous that I answered the door that day.
Very grateful for that.
Yeah, I am too. But Hunter, when you were in the legislature, which committee did you serve on there? Which committees were you involved in?
Yeah, so I served on the Capital Investment Committee, and I should say as a shorthand, I call them committees, but really they were technically divisions under the Ways and Means Committee. But so the Capital Investment Committee, the Health and Human Services Finance Committee, the Long-Term Care Committee, and the Judiciary, Finance, and Civil Law Committee, which oversees the functioning of the state judiciary.
That's a mouthful.
It is, isn't it?
Now,
Say that 10 times fast.
We should tell people, too, you're a young guy and people'd say, well, we expect he'll be in the legislature for a long time. But after one term, you opted to step away from running for re-election. Tell us why.
Yeah, absolutely. So, when it came time to evaluate the lofty decision of whether or not to run for re-election, I decided that I wanted to return to school to complete my education because my bachelor's degree had been on hold ever since I took that leave of absence. Right. And I think that there's a huge benefit in the baton of power changing hands frequently and getting new ideas and new people into these elected positions. And ultimately, kind of like I said, I'm very grateful that my community entrusted me to represent them in the State House of Representatives. And I'm grateful to continue to be active in my community.
Very good. We should say that when you were in the legislature, I know one issue that was very dear to your heart was a proposed ban on so-called conversion therapy. And we're talking here about legislation that would have banned, some people have called it pray the gay away. But it was legislation that you co-sponsored with Senator Scott Dibble of Minneapolis, which basically would have banned a practice that has no scientific evidence behind it and that actually was causing harm to young LGBTQ men and women. Tell us a little bit more about that.
Right, absolutely. So a lot of people don't know that the practice that's known as LGBTQ plus conversion therapy is still legal in the state of Minnesota to this day. Unfortunately, we weren't able to, despite our best efforts to build bipartisan support, we weren't able to pass a bill through the legislature during my time there or since to legally outlaw LGBTQ plus conversion therapy in Minnesota. But I will say Governor Walz, and I'm very grateful to him for this, did sign an executive order last July, I believe, that outlawed state Medicaid payments to services including LGBTQ plus conversion therapy. So that's a step in the right direction. But
more needs to be done.
More needs to be done, absolutely, because there's no beating around the bush. There is nothing scientific about LGBTQ plus conversion therapy. It's harmful, it's fraudulent, and people who practice it are fraudsters themselves. And so that's why we wanted to ban it, not only out of an equity motivation, but because it does cause real harm to children, especially and
Describe
youngsters.
some of that harm.
Right, absolutely. I mean, there's years of psychological trauma that happen from going through these kind of regressive memory therapies where where practitioners will try to install false memories or false interpretations of memories in LGBTQ plus youth to really try and turn their own psychology against them in who they are to make them feel ashamed.
Which can lead to feelings of depression,
Absolutely.
of suicide,
Absolutely.
and sometimes young people acting on those feelings.
Right.
Which is a tragedy for their families and friends.
It absolutely is, yes, and it's happening still in Minnesota today, and it has to be stopped because we have to protect kids and families. We do.
Let's transition to a broader discussion about public health in Minnesota. We are just coming out of, well, hopefully coming out of the worst of the COVID-19 pandemic, which none of us had ever heard of this prior to 2020. But in the spring of 2020, we saw huge dislocations in our economy. Millions of Americans became ill. Sadly, too many people have died. And at the heart of this issue, one has to examine what the public health response has been to it. It has varied all over the country, but one thing that we discovered during the COVID crisis, I think you'd agree with me, is that public health has been terribly underfunded in our country, including in Minnesota. Maybe not as bad in Minnesota as in some other places, but just this chronic underfunding of the very institutions that we need to function to respond to a crisis such as COVID.
Right. No, absolutely. I think that the COVID pandemic laid bare the inequities in our society, especially around our public health infrastructure and also our preventative health infrastructure, both of which have been neglected for decades, really, and haven't been built out. We look at other countries that have, systems where, where healthcare is publicly funded, and of course those systems have their own issues as well. But we saw one common theme is that they were able to mobilize much more quickly quickly and in a much more robust way, turning these hospitals into places where people could get immediate, quick treatment for COVID, where they just had that extra capacity and logistical capability that the United States as a whole just kind of lacked, because so much of our healthcare has been and healthcare system has been predicated on this idea of how can I squeeze the most money out of especially the sickest people, but everyone. I've never met a single person who says, wow, I'm really happy that I got this great big hospital bill that goes towards the CEO of these hospitals, or wow, my insurance premium went up another 15-20% while the CEO is raking in $30 million a year. I don't think anyone has ever said that. And there's a reason why, so few countries modeled their healthcare system after the United States' system, because ultimately our system of for-profit care just doesn't prioritize the needs of patients and people.
Right. And I think it's true, I think you might agree with me that the COVID pandemic, we talked about disparities. We saw a lot of disparities that were laid bare by this pandemic. We saw racial disparities with access to healthcare. We saw income disparities. We see an urban-rural disparity, and you see a situation now in Minnesota and many states where rural hospitals and clinics are closing, which is requiring patients to travel greater distances to get basic health care and to get preventative procedures that can help prevent them from getting sicker.
Right. Right. No, absolutely. And I think that is, you underscored a lot of the major flaws in our system, is that it doesn't prioritize the needs and health of people. It's really, we've allowed these large corporate entities to just run to the bank with everyone's money without any accountability. And really, the people who are left disadvantaged at the end of the day are the people who are especially the most marginalized in our society, who already have inadequate access to health care.
I want to ask you, because it was prominently in the news this week, Farm Fest happened, and there was a very fierce debate between Governor Tim Walz, Democrat, and his Republican challenger, the Republican-endorsed candidate, Senator Scott Jensen. Part of that debate touched on the COVID issue, where Senator Jensen was highly critical of Governor Walz's response to the COVID pandemic, saying the governor went too far on school closures, the governor went too far with mask requirements, and that he really didn't handle the COVID crisis well. What is your reaction to Senator Johnson's criticisms?
Yeah,
which I might add are more broadly criticisms of Republicans in the legislature and in the Congress too.
Yeah, so I think it's really unfortunate that Senator Jensen has continued to politicize the COVID-19 pandemic. In hindsight's always 2020. And did the Congress get everything 100% right with this novel respiratory pandemic that, we have no modern basis for trying to address? But what I will say is that I think Governor Walz did his level best to follow the science, to actually, listen to people and constantly reevaluate the information that was coming out so that he could make the best decisions possible, along with my other colleagues in the legislature, to ensure that as few people died as possible during this pandemic, especially when we didn't have vaccines.
Senator Jensen's criticism reminds me somewhat of some of the criticisms I've heard from U.S. Senator Rand Paul leveled against Dr. Fauci, saying, well, Dr. Fauci, you changed your story. You're saying something different about COVID now than you did a few months ago. As we learned new things, as we gathered new data on how people were responding to COVID and how the illness was manifesting and spreading, of course you change your response, right?
Yeah.
You wouldn't react the same way to something when you're acting on old information.
Right.
And the thing that's really remarkable, and this sort of leads us into our next area of discussion, just think of this, Hunter, that in the space of less than a year, they developed not one, but several vaccines that significantly didn't necessarily prevent people from being infected, but significantly reduced the likelihood of hospitalization and death. That is a monumental achievement in medical science, I think, and I think most people would probably agree.
It truly is, and I think what we saw out of this pandemic is that when we actually, invest our resources in scientific research that is quickly translated to implementation to improve public health, that we can achieve great things. We have some of the greatest minds in science anywhere here in Minnesota, and I've worked with some of them, and they are phenomenal people. And you're right, information is constantly evolving, and we should, all I think prioritize the continual evolution of incorporating that new information into public policy decisions,
into how we respond.
Exactly.
Right. And we talk about our institutions in Minnesota. I think all of us are proud of the Mayo Clinic, the University of Minnesota, other institutions in our state. Mayo Clinic particularly has embarked on an adventure recently where they are attempting to gather lots of biomedical data on their patients to do research, hopefully leading to their ability to better predict and manage chronic serious illnesses, including cancer, diabetes, other health problems, to try to manage and treat them before they become less treatable and less successful. But this type of research opens sort of a Pandora's box, doesn't it, about ethical issues such as who actually owns the biodata of an individual. Who can it be shared with? Can employers use it? Can insurance companies use it to set rates? What are your thoughts about some of these ethical questions that come up with biomedical data?
Absolutely. Well, and this kind of pertains to the intersection of my time serving on the Health and Human Services Finance Committee, as well as the Judiciary and Civil Law Committee, because on the Civil Law, Judiciary and Civil Law Committee, we talked a lot about data privacy. And so this is one of the, I think, the most important issues of our time as we continue to make advancements in genetic research and in biological science as a whole. I think it holds a great deal of promise for the advancements that we can make in treating, genetic diseases or other intractable conditions. As you heard in the news this week, potentially even reviving organs post-mortem. Which no one ever thought would be possible. So there are a lot of frontiers that continue to be explored and expanded on in the biological sciences. I myself have worked in genetic engineering in the past. I have experience working with CRISPR and in designing experiments. And I think that as we move forward, we always have to be cautious of having information that isn't securely protected, especially people's sensitive genetic data, falling into the wrong hands. So I think there must be significant safeguards, and they can never be allowed to be capitalized on by insurance companies or anyone else who would seek to use that to for actuarial purposes.
Well, and more than that, I would say insurance companies that might use it to deny coverage to
exactly.
people in the future if they were able to do that, or to try to limit the types of insurance coverage they could get.
Exactly.
That could be really problematic for people.
It absolutely could be, and it would only exacerbate in that instance, especially the existing health inequities that we have. Now, don't get me wrong, there are a lot of very exciting things happening in science right now, and there's reason, I think, to be very optimistic about the advancements that are being made. But we do have to be cautious of ensuring that people's protected health information, especially at that deepest, most personal level of your very genetic code, is protected from being exploited, because we all have genetic one could call them deviations, but we're all unique people, right? There's no real template for our genome that's the same person to person. So we need to make sure that, especially like if insurance companies were able to identify, this person has this single nucleotide polymorphism, or SNP, which is a biomarker for potential linkages to gene-based diseases, making sure that information isn't exploited.
And we should be clear too that what we're talking about, a lot of these public policy questions about who owns your biodata, how can it be shared, how can it be used by different people or by different private sector companies. Legislatures and Congress are grappling with these very types of questions right now, and will be for the foreseeable future.
Right, absolutely. Especially as we get more and more into, this arena of, potentially redefining what it means for someone to be brain dead or heart dead. This is one of the reasons why legislatures need to listen to the experts when it comes to scientific advancements and current, the current state of things in science, and why we need more scientists, honestly, to run for the legislature and to run for all elected seats, because ultimately we need policymaking that is based in the data and that's based in the expertise that people bring to the table.
Sadly, in the political realm, it seems like during the COVID crisis of the past couple of years, we saw just the opposite. You saw people with no medical or scientific background whatsoever giving advice about treatment for COVID and other serious illnesses when they have no expertise whatsoever. I think of the example close to home here, Mike Lindell, the MyPillow guy, giving out really what was essentially medical advice. He's not qualified to do that, nor should he, nor should anyone.
Absolutely.
I mean, it's problematic too, and well, those are things that voters are going to have to look at closely when they make decisions about who they're going to elect to the legislature and to Congress.
Right. And I would say too, this upcoming election is going to be one of the most important of our, and I know people say this every election cycle, right? That it's one of the most important of our lifetimes. But, kind of what you alluded to earlier in this segment, we have a Supreme Court that is completely out of step with the American people and is really out of whole cloth, making their own judicial and legal doctrine at this point.
Well, you have legislatures, by striking down 50 years of established American law in the Dobbs decision, knocking away the right to choice in the first trimester, you now have 50 different legislatures going 50 different ways.
Right, and it's created legal chaos.
And you have the situation where you have some state legislators, the most radical proposition, I think, that doesn't sit well with most people, is saying that you're going to require a woman to carry a baby to term even when she's a victim of incest, which is a reprehensible thought to people. But yet that's what you have. It was interesting that in the state of Kansas this past week, we saw Kansas voters in an overwhelmingly red state rejected a change to their state constitution that would have opened the door to legislation to basically do that, to take away any right to terminate a pregnancy for any reason, at any point.
Right.
And so it's very interesting, these types of challenges we have coming.
It is, and I think we're confronted with, once in a lifetime, really, constitutional and legal questions that, we're going to have to decide what the future and what the trajectory of our country is going to be. It is really with the people, and I think the people ultimately will come together and will decide that we want to live in a free country. We want to live in a society where everyone's human dignity is upheld, where people's basic needs are being met. And unfortunately, I think a lot of people in positions of power are out of step with that right now. But
and after all, that's the American ideal.
That's the American ideal.
That is the American ideal.
Right.
Our time is running short. Hunter Cantrell, former Minnesota State Representative, I hope we see you run for office again someday.
Well,
it's too early to tell what that office will be, but I have great confidence, Hunter, in your talents and abilities. Thank you for coming on Access to Democracy today, sharing your insights on healthcare issues and some of the challenges coming up. And come back and see us again.
I absolutely will, Steve. Pleasure to join you today.
Thank you.
Thank you.